Diagnose this case with me. You have a 6-year-old female spayed Persian kitty that arrives to you for 3 days of daily seizures. Now, she has no prior seizure history, and she arrives to you paraparetic, she's tremoring, she's weak, and she's incoordinated. And here's a video of what she looks like. She's stumbling around the exam room, weak in her back end, and her eyes look dilated and they're delayed with her PLRs, and she's got a decreased menace in both eyes. Her signs point to an intracranial lesion, but she's young and her signs are persistent. So you're thinking, you know that epilepsy can happen in younger animals, but these cats are they're normal between seizures. Also, her clinical signs are multifocal, and that points to her having multifocal brain disease. For example, she's got seizures. Seizures point to forebrain. She's got delayed PLRs with mydriatic pupils, and that points to midbrain or cranial nerve pathways. She also has cervical ventral flexion, which points to brainstem and vestibular involvement. She's got incoordination and tremors, which points to the cerebellum, and she's got a decreased menace, which points to a forebrain or cerebellar problem. So everything here is all over the place. Also, her exam points to a symmetric disease. She's got bilateral paresis, bilateral mydriasis, and she doesn't have unilateral signs. Like, she doesn't have only a one-sided proprioceptive loss. She doesn't have a one-sided cranial nerve deficit. So things that you are considering that are immediately lower on your list is congenital malformations. Those typically show up when cats are younger. Solitary brain tumors like a meningioma or a glioma would have more lateralizing signs. Trauma, obviously you would have some history of trauma, but a contusion or a hematoma would usually have more lateralizing signs on one side or the other where more of the trauma occurred. Same with a vascular event. Usually that would be a more asymmetric sign where that particular vascular event happened in the brain. So your highest priority at this point are metabolic causes, toxic causes, and inflammatory or infectious causes. Considering metabolic causes, what are they? Hypoglycemia is one example. Electrolyte disturbances, for example, if you have hypernatremia or hyponatremia that happens acutely, that can cause brain problems. Hepatic encephalopathy and nutritional deficiencies can all cause metabolic brain disease. For toxic causes, you're thinking of diet-related toxins, lead exposure, permethrins, or mycotoxins. Those are all things that can cause brain signs. And now for inflammatory and infectious causes, you're looking at things like FIP, toxoplasmosis, cryptococcus. So you right away are going to run some blood work. And you run the blood work and it shows pretty unremarkable findings except for an elevated AST and a CK. Now these are all muscle enzymes, and you attribute that to those episodes of rigidity and muscle contractions that have been happening during the seizures probably, or while she's been tremoring. So some things are going to get crossed off your list. For example, under the metabolic, you are going to cross off hypoglycemia. You don't see any electrolyte changes. You don't see anything that points to hepatic disease like liver enzyme changes in the hepatic markers of what the liver produces, like BUN, glucose, albumin. Those are all made by the liver. Those are all normal. So nutritional deficiency is still on your list. Now for toxic causes, you're looking at diet-related toxins, lead, permethrins, mycotoxins. Now, because you don't see elevated liver values, all of these are going down on your list of likely possibilities because of the lack of liver enzyme changes. You don't see anemia or target cells that you might see with lead exposure. Also with lead exposure, you would have had some history of GI signs. And with mycotoxins, you usually have hyperthermia and diffuse excitation symptoms with no discrete neurodeficits per se. So all of these seem to be going in the way down on your likely list. So when you're looking at inflammatory and infectious causes, you're kind of ruling out FAP because you don't see any elevated globulins and you don't see that classic albumin-globulin ratio that supports FIP. Toxo and crypto are still on your list, although you consider them less likely because you don't see anemia of chronic disease on your blood work. You don't even see any evidence of white blood cell inflammation, but you are sending off infectious disease testings with titers and PCR. So with your blood work results, you now start to ask the owners some more specific questions about exposure history. You're asking your owner, is there any chance of moldy food, spoiled food? Does this kitty have any prey ingestion, that's happened? Does this kitty eat raw food? Those things could have exposed the kitty to some infectious diseases. Any diet changes? And what is this kitty's diet specifically? No moldy food, but this is an indoor-only kitty with no access to prey and not on a raw food diet. But the owner has been using a bag of dry food, and this was stored in a pretty hot garage. You just got back your MRI findings on this cat, and what do you see but bilateral multifocal hyperintense brain lesions in the brainstem and the midbrain nuclei. So hyperintense lesions all over the place and all very symmetric. So given these specific findings on your MRI, the fact that this owner kept commercial food recently for the last 2 weeks in a hot garage, you immediately suspect this must be thiamine deficiency. You treat the cat with 70 mg per kg of thiamine IV initially, and then 30 mg per kg sub-Q for 3 more days. And vision and vestibular signs resolve quickly within 3 days, and she's absolutely normal within 1 week. The end.